Tubal ectopic pregnancy diagnosis. This teaching video is meant for undergraduate medical students. What are the two most common symptoms of ectopic pregnancy? 1. Abdominal pain. 2. Vaginal bleeding. When abdominal pain and or vaginal bleeding are present in a pregnant patient, ectopic pregnancy should always be ruled out. However, remember, over 50% of patients are asymptomatic and they do not have an identifiable risk factor for ectopic pregnancy. So, ectopic pregnancy may not be suspected at all. How is an ectopic pregnancy diagnosed? The most important investigation is transvaginal ultrasound. Equally important is serum HCG level measurement. Serial evaluation with transvaginal ultrasonography or HCG level measurement or both often is required to confirm the diagnosis. This means if the first transvaginal ultrasonography is unable to confirm the diagnosis, it has to be repeated. And this investigation, transvaginal ultrasonography, is often supplemented with repeated HCG level measurement. Transvaginal ultrasonography can sometimes give a definitive diagnosis. If it shows no intrauterine pregnancy and a gestation sac with a yolk sac or embryo or both is noted in the adnexa. However, most ectopic pregnancies do not progress to this stage. In practice, this means that the first transvaginal ultrasonography may not give a definite diagnosis. That is why, as I have already mentioned, you need serial transvaginal ultrasonography supplemented by serial HCG estimation. The most common ultrasound finding is an adnexal mass, but this has a positive predictive value of only 80%. Visualization of an intrauterine pregnancy by ultrasound, either transvaginal or transabdominal, eliminates ectopic pregnancy, except in the rare case of heterotopic pregnancy. This is the presence of both intrauterine pregnancy and an ectopic pregnancy. For all practical purposes, the presence of an intrauterine pregnancy excludes the diagnosis of ectopic pregnancy. Heterotopic pregnancy is a rare event occurring in 1 in 30,000 normally conceived pregnancies, but their incidence is 1.5 per thousand in assisted reproduction technology pregnancies. In a pregnant patient that is UPT positive with no intrauterine pregnancy on transvaginal ultrasound, when is the diagnosis of ectopic pregnancy suspected? When there is an extra ovarian adnexal mass, that is a mass which is separate from the ovary. This is the most common ultrasound finding in ectopic pregnancy, present in 90% or more of cases. Another finding is intraperitoneal bleeding on transvaginal ultrasound, that is presence of echogenic fluid in POD. If the initial transvaginal ultrasound is non-diagnostic, that is, it does not show an adnexal mass or echogenic fluid in the POD, then you have to do serial measurements of serum HCG concentration. Summary of ultrasound findings in suspected ectopic pregnancy. If ultrasound shows an intrauterine gestation sac, ectopic pregnancy is practically ruled out. If the ultrasound shows a gestational sac with a yolk sac or embryo within the adnexa, it confirms ectopic pregnancy. Mind you, the gestational sac should contain either a yolk sac or embryo. Just the presence of a gestational sac without a yolk sac or embryo does not confirm ectopic pregnancy, but it is highly suggestive. If the ultrasound shows a mass within the adnexa and an empty uterus, that is, the uterus does not show an intrauterine pregnancy, then there is a very high chance of an ectopic pregnancy being present if the woman is pregnant. That is, the urine pregnancy test is positive. This is usually the most common ultrasound finding in suspected ectopic pregnancies.